So this is A1. So a sports practitioner is defined as a person charged with provisions of both therapeutic and rehabilitative care for athletes, pointing them towards attainment of optimum performance and recovery. They therefore concern themselves with one arm of prevention, treatment and rehabilitation. These professionals normally work in multidisciplinary teams comprising coaches, physiotherapists, sports scientists, sports practitioners, can specialise in fields such as sports therapy, sports massage and rehabilitation. Their expertise enables the athletes to maintain their physical, mental health after returning from an injury. So a range of therapeutic techniques include manual therapy, rehabilitation exercise and soft tissue manipulation. So this is applied by the sports practitioner to help achieve peak athletic performance while speeding up recovery and limiting further risks to injury. So coming back from injury can also increase your risk of injury. So if you don't rehabilitate properly, then your risk of injury then increases again. So examples of this include repetitive strain injuries in bowlers in cricket. So in the shoulder and the lower back pain, all rehabilitation programs that sports practitioners deal with to get players back into play faster and safer. It also extends to sports practitioners who are utilised throughout the career of an athlete, from competition to training and into rehabilitation after injury. They design preventive programs that reduce the risk of injury by focusing on an athlete's biomechanics and physical conditioning. For example, fast bowlers in cricket are prone to repetitive strains, in particularly at the shoulder and the lower back. The sports practitioner develops rehabilitation programs to deal with specified problems like they are especially crucial in high performance environments where demands for athletes are very high and injuries reduce the performance and career longevity dramatically. In cricket, sports practitioners are involved immensely during the training sessions and matches, as such bowlers in cricket seasons may embark on special strength and conditioning programs to ensure continued endurance and prevent injuries that could be sustained from the repetitive nature of the movements involved bowling. So this is a lot of strain going on the lower back and the shoulders when you're bowling, because there's a lot of pressure, a lot of power going through your body when on that hard slam down of the foot when you're bowling. So they also play a very important role in rehabilitation, helping players recover from injuries such as hamstring strains, rotator cuffs injuries. The work of the sports practitioner is extended to off-season periods when they engage in what is called pre-rehabilitation. That is the conditioning of the athlete's body in anticipation of injury during the competitive season. One of the roles of sports massage practitioner helps optimize athletic performance by improving flexibility, reducing muscle stiffness and increasing blood circulation. These effects contribute to enhanced muscle functions and the readiness for physical exertion. Another one is in injury prevention. This is done by identifying areas of muscle tension or imbalance. Practitioners can address potential injuries and injury risks. Regular massage can reduce likelihood of overuse injuries and sports muscular health. Recovery and rehabilitation massage is integral in post-activity recovery, promoting relaxation and aiding the removal of metabolic waste products like lactic acid. It also accelerates the healing process after injuries by improving the circulation and reducing scar tissue formation. Pain management is another role that a sports practitioner has. This is done by giving a sports massage which helps manage both acute and chronic pains through techniques that stimulate pain relieving endorphins and reduce inflammation in soft tissues. Psychological support is another role that falls under the sports practitioner. This is done with therapeutic touch and focused care of massage can reduce anxiety and pre-competition nerves, helping athletes maintain a positive mental state. Education and guidance is needed for an athlete, so the sports practitioner educates athletes about the body mechanics, posture and technique to reduce strain during activities. The guidance can complement training regimes and enhance long-term health. The STA is a professional body for sports therapists. It aims to uphold high standards in sports therapy practice, encouraging CPD among its members. It ensures members practice under strict code of conduct and are completely trained in all sports therapy techniques, including injury assessment, treatment and rehabilitation. The STA Association set out competency-based frameworks for practitioners to follow. Sporting examples of this are: a cricket team might hire a STA registered practitioner to monitor and treat soft tissue injuries among fast bowlers who are particularly susceptible to shoulder or hamstring problems because of the highly intensive repetitive action. The STO supports the sports therapist with guidance, best practice, insurance and CPD opportunities. The STO provides accredited courses to provide competent and updated knowledge of the latest practices in injury management by therapists. This is found in professional cricket leagues, where the STO works with players and in training and during the event to prevent injuries such as muscle strains, which are more likely considering the plane of explosive activity experienced during the fast bowling and batting. BASARAT is the governing body for sports rehabilitation. Rehabilitation practitioners, showing that its members are clinically competent. It governs accredited programs and ensures its members adhere to strict code of conduct, code of ethics and CPD. This is for athletes. BASARAT practitioners may work with cricket players recovering from lower back injuries. Lower back injuries, common for fast bowlers, are designed rehabilitation exercises to strengthen the core and reduce further injury risk. CNH is the voluntary regulator of complementary healthcare. CNH reflects that the practitioner has met national standards and is competent to deliver appropriate safe care. The CNH would mean that, for example, sports practitioners using massage therapy techniques have had to meet professional requirements. In cricket, soft tissue therapy given by a massage therapist registered with the CNH will be allowed during an event and outside of the event in training for the players. This would help them to reduce muscle soreness and also have a better post-game recovery. Pitchside environments demand immediate and effective care due to the fast-paced and dynamic nature of cricket matches, and the responsibilities of this include management, first aid, pre-match warm-up. Practitioners must be equipped to handle acute injuries like sprain, muscle strains or impact injuries. Techniques such as taping and compression are often applied to stabilize injuries before further treatment. They provide critical first aid and determine whether players can continue or need to be substituted, ensuring players' safety and compliance with protocols. Sports massage and dynamic stretching are used to enhance blood flow, preparing players for the game, particularly focusing on areas prone to overuse like shoulder and knee in bowlers. They face challenges with being pitchside, such as limited time and equipment, especially during live matches. The clinic setting allows for detailed assessment, long-term rehabilitation programs and preventative care. Practitioners perform in-depth evaluations of injuries or physical imbalances, often using tools like ultrasounds or gait analysis to diagnose issues. Designing and implementing personalized recovery plans that players to peak performance addressing underlying issues like techniques can improve muscle imbalances or joint misalignments to prevent further injuries. For example, soft tissue. The advantages to being the clinic for a sports practitioner are access to specialised equipment and resources, Practitioners often target areas crucial to cricket performance, such as wrists for batters or shoulders for bowlers, addressing minor discomfort or tightness during breaks to ensure players can perform their best. Techniques like effleurage and petrissage are used post-match to reduce muscle soreness, promote relaxation and prepare players for subsequent matches. The challenge for being sports massage practice is subject to the demands of professional standards regarding the quality and safety and the hence effectiveness of any treatment administered to athletes. Standards of competence, ethical guidelines and continuing professional development are described by professional associations for practitioners. Compliance with these standards is of utmost importance as it requires there to be trust between practitioners and athletes concerning the appropriateness of care with respect to evidence-based best practice. For example, the professional organisation like SMA ensure that the sports massage therapists are appropriately trained in prevention and treatment of the sporting injuries that would improve the overall athletic performance. The positive reasons for sporting massage standards are that they build credibility into profession while offering protection to the athletes through safer practice. For instance, sports massage therapists who work under professional associations such as the Federation of Holistic Therapies will have to follow stringent practices in assessing and applying massage skills. With post-care, hence they offer a safer and more appropriate intervention for the athletes. Professional development. Associations like the BASR and that require that their practitioners update their skills through training and certification programs. The standards for practice with different sport environments ensure that treatment that athletes receive is of the highest quality, safe and effective. These particular standards are slightly different depending on the sport discipline, but overall aim to ethical practice, practitioners' competence and safety and performance of an athlete. There are established advantages to working in an MDT in the sport that can enable more holistic and thorough treatment planning, since physical and psychological aspects of the athlete's care can be addressed simultaneously. The MDT model supports the communication of several professionals such as physiotherapists, sports therapists, nutritionists, psychologists and strength and conditioning coaches towards a more holistic approach in managing an athlete's health and performance. The view is supported by MyOFI. Professional athletic settings have an implement standard of specialist insurance effective in athletes' care. For instance, contact sports such as football, rugby and cricket all have umbrella organisations that have set certain standards. That is, for example, the need for the continuous profession. A practical example involves professional cricket, conditioning coaches, nutritionists and sorts like to manage comprehensive well-being of players. Indeed, Indeed, physiotherapist or massage itself is not enough to correct them, but also biomechanical correction by conditioning coaches, nutritional advice for recovery. Sports massage practitioners contribute by identifying prescribed corrective actions. This synergy enhances recovery time and reduces re-injury support and athletes' mental and physical preparation support. Sports massage enhances blood flow and reduces pre-competition anxiety, complementing the work of sports psychologists in stress management. Within an MDT, sports massage practitioners can access and contribute to research efforts. This collaborative environment fosters evidence-based approaches to therapy, improving the effectiveness of interventions.